Uncontrolled hemorrhage is the #1 preventable cause of trauma death. When severe bleeding occurs, every second counts. In high-stress trauma situations, cognitive overload and loss of fine motor control can make it difficult to apply bleeding control devices quickly and correctly. What's needed is an intuitive device that can be applied swiftly when time is critical. Traditional tourniquets can be difficult to apply, especially on partially amputated or severely injured limbs. Threading straps through buckles takes time. Incorrect application can lead to slack, slippage, and unreliable bleeding control. The MAG-TQ is designed to overcome these challenges. MAG-TQ is an innovative tourniquet with magnetic buckle technology designed for fast, easy, and effective bleeding control when seconds matter. Built for high-pressure environments, it can be applied rapidly and even one-handed to stop bleeding and restore control. The MAG-TQ features an innovative magnetic V-buckle system that self-locates and locks instantly. This eliminates the need for threading straps through buckles, enabling faster and more intuitive application, even in high-stress situations. A durable, high-strength strap allows rapid tightening and secure tension retention, helping maintain consistent pressure to control bleeding. The precision-engineered aluminium windlass rod generates the force needed to achieve arterial occlusion, allowing responders to quickly stop bleeding when seconds matter. A dedicated right-on time tab allows responders to clearly record the time of tourniquet application, supporting safe handover and continued patient care. Now, let's see how the MAG-TQ is used in a real-work emergency. The MAG-TQ tourniquet is intended to be applied around a limb or extremity to occlude arterial blood flow and control life-threatening extremity bleeding. Rapid application in under 10 seconds due to the self-locking magnetic V-buckle. It should only be used by or under the supervision of trained emergency responders. How to use. Apply the tourniquet 2 to 3 inches above the bleeding site. Connect magnetic buckle. Pull tight above bleeding site. Twist windlass rod until bleeding stops. If bleeding is not controlled, tighten or reposition or apply second MAG-TQ above the first. Secure windlass rod in gate. Route remaining strapping, close with time tab and record time applied. Rapid bleeding control saves lives. MAG-TQ is an innovative tourniquet with magnetic buckle technology designed for fast, easy, and effective bleeding control when seconds matter. The MAG-TQ is designed for fast, secure application when every second matters.